Hello, hello. Come on in and take a seat. My name is Lee and I am the MA that's going to be bringing you back and checking you in. It's very nice to see you. Yep, been a little bit, but always a pleasure. Usually under better circumstances for sure, but always so nice to see you. I have to act like I don't know who you are. Do you mind giving me your first and last name? Awesome. I just want to get you checked into the system. Any changes to your insurance at all? Okay. And emergency contact, any changes there? Yeah, no problem. Okay. We changed it there for you. And who is that in relation to you? Gotcha. All right. So it looks like you're coming in with a new breast concern. Gotcha. I am going to ask for more details in a second. Let me just open up your chart and make sure that there's no new changes as far as medical history, just seasonal allergies. Okay. Any meds that you're on? Or vitamin D? Yep. You just take that daily. Do you know the amount of units for that vitamin D? Like, is it a 600, an 800? Okay, gotcha. Okay, so we've included that. Surgeries, any new surgeries since we last saw you? Okay, any changes to your social history? And then any new family history, medical diagnoses, or cancer diagnoses since we last saw you? Everything that's there stayed about the same. Okay. Any changes to your sexual history at all? Okay. Okay, let me start the chart here for you. Now tell me a little bit about what's been going on. You said for how long now, sorry? For the past month? Okay. In your left breast. Kind of close to the arm. Okay. Gotcha. Now, do you feel like it's grown at all in size? Do you feel like it's been relatively stable? Okay. Any redness at all in the area? Okay. Any other notable skin changes that you've noticed with that breast? Okay. Any discharge coming out of the nipple? Any nipple inversion, or it kind of looks like your nipple's getting pulled inward? Okay. Let's see, any swollen lymph nodes in the area that you've noticed, or noticed? And then any trauma to that breast at all? No, none notable. Okay. What about your other breast? What about your right breast? Are there any concerns there at all? Nothing that you've noticed? Okay. You said yeah, no, it's so good that you performed those self-breast exams, and it's great that you came in just for us to double check. If you were to say roughly how big it was in your opinion? Okay. Now, is it hard? Is it soft? And when you push on it, I don't know if you've made note, but does it like move around, or does it kind of stay in place? Okay. Right. Well, I think I have all the information that I need from you regarding that breast lump. So, Leanna will take a look at that for you for sure. I'm going to put some sanitizer on. I just have to get your vital signs. Do you know roughly how tall you are? Okay. Just put that in here. And roughly how much you weigh? Okay. Let's start with your blood pressure. go around your arm. Here. There you go. Just sorry. Does that feel nice and snug? Okay. Alrighty, let's get your blood pressure taken care of for you. 1 second, if you could just rest both feet, uncross your legs. Thank you. Blood pressure is normal. Let me take this off of you here. Just kind of relax your arm. There you go. I'm just going to slide that out there. Perfect. So yeah, blood pressure was normal today. Are you noticing like any viral symptoms, cough, congestion, runny nose, chest pain, anything like that? Okay, just making sure. Okay, I'll put that away. We're just going to get that temperature check right underneath the tongue, okay? Just put that back here. This is just going to go underneath your tongue. Okay, give it a few seconds to kind of register here. It's been pretty slow lately, so I apologize. Perfect. All right. No sign of a fever. Let me put that back on here. Let's just throw this away. Alright, good. Just gonna re-sanitize. Alright, so I think I have all the necessary information that Leanna, the PA, is going to need to know. So, what I'm going to do is let me hand you a gown. I'm just gonna sneak past you here to grab it. So, you can just take off your shirt and you'll be putting this gown on. You want it open from the front to do the breast exam. And then Leanna's gonna do an assessment on both breasts just to compare each side so that we have like a reference point to go off of. And if needed, of course, we will order the necessary imaging for you, okay? So I'm gonna leave this right behind you here on the counter. And I'm gonna give you some privacy. Let me just make note of your vitals here. And let me just check you into the system. Do you have absolutely any questions at all for me while I'm here? You're okay? All right, just want to make sure. All right, awesome. I have all the information that I need on my end. I'm going to give you some privacy, and Leanna, the PA, will be in to do a comprehensive breast exam for you, okay? Absolutely is not a problem at all. You know, we'll get this figured out for you, okay? All right, I'll see you a little bit later, okay? All right, see you. Coming in. Hello. It's nice to see you. Lee, the medical assistant, just got done telling me kind of what was bringing you into clinic today. It looks like you have concerns for a left breast cyst that's been present for about a month. Okay. And then she kind of updated me regarding like skin changes, nipple discharge, that sort of thing. Anything you've noticed at all with your other breast? No? Okay. All right. So today we'll be doing a full comprehensive breast exam, if that's okay with you. I'm just going to grab some gloves. We'll maybe do some sensory tests in that area of concern. I'll kind of mark it and measure it. And then we will order you the appropriate imaging, okay? Yeah, for sure. Do you have absolutely any questions or concerns before I get started with this portion of the exam? You think you're okay? Okay. All right. Well, let me get your chart set up here. I am just going to grab some gloves. Okay. So what I'm actually going to do is I'm going to go over to your other side and use that as a comparison since you're not having any difficulties with that side, okay? Okay. You, of course, just let me know if at any point you get very uncomfortable. I am just going to untie this for now, just so we can do that exam. I'm just going to untie this one. Okay. There you go. And we can leave this side covered if you want. We're just going to open up this side. I apologize if my hands are cold. Anyway, let's just get started here. Seeing if I do feel any lumps maybe that you weren't able to feel for this breast. Not seeing any skin changes or nipple inversion. No pain, right? Do you mind lifting this arm a little bit? There you go. Not feeling or seeing anything concerning here, so that's good. Just kind of doing a more superficial. And then let's see, there's no nipple discharge. Okay, I'm going to come around to your other side now so we can look at that area of concern. And she was telling me there was no trauma to the breast tissue at all, right? Okay, just making sure. Yeah, I feel what you're talking about there. Let me just assess the rest of the breast so that we can just focus the rest of the visit on that area. And can you lift this arm? Yeah. Okay. Again, noting for the skin changes as well. Okay, so I am going to mark up where I'm feeling that cyst. To about here. Okay, there we go. So I kind of made a circle around it. Let me know if you feel this. Do you feel that? Good. How about here? Here? Good. Okay. Just wanted to make sure sensation was still intact. So I'm just going to measure that area. and that it will kind of what we find as a result. Place my clipboard there. Okay, I'm just gonna measure that area now. These measurements here. I'm just gonna diagram where it's located. I am gonna take a light here just to make sure everything that I'm reading is accurate. It's definitely hard to measure when it kind of comes and goes like that, right? Okay, I think it's appropriate markings, especially for when we get the imaging. Let me turn that light off. So, I've kind of mapped out the area of concern. What's going to happen? Let me just take off my gloves here. Okay, so what's going to happen is I'm going to write you an order for some breast imaging. And so they're going to take a look inside of the breast tissue and let us know if this may be a potential area of concern or if we need to do a breast biopsy of that cyst, okay? Now, depending on your age, will kind of correlate to what type of breast imaging is done. So people who are typically younger have way more dense breasts, and so they tend to go for a ultrasound over a mammogram, whereas mammograms are usually done on average when they're usually like between like around the age of 35 and higher, give or take a few years up and down. But so I'm gonna write in order for you to get that script. I'm gonna hand you this order actually. So this is going to be for you. I want you to take that to check out. The girls are going to give you the number to schedule that breast imaging. And then I'm going to call you once I get the imaging results done. And the nice thing about the imaging center is they will normally tell you how everything is looking before you even leave. Yeah, so you'll probably honestly know even before me. Exactly. So keep those markings on there. They shouldn't wash off from the shower, especially if we're able to get you in the next couple days. But if you have absolutely any questions, concerns, especially regarding that breast imaging, let me know. But otherwise, I will be contacting you once they send me those results, just to make sure that you kind of know the game plan and that everything is pretty clear. Absolutely, yeah. Just remember that there are a lot of benign common breast conditions, so definitely not something that I would worry about right now. We just need to be sure with that imaging. For sure, absolutely. Let me just get you covered back up here. I'll give you some privacy to get dressed, okay? All right, please enjoy the rest of your day, and I will wait for that imaging to come in. You're very welcome. I'll see you a little later.